I will confess right up front that I have a lot of things swimming around in my head, trying to connect the dots with everything we've heard today. I want to get us started by offering kind of a loose framework for thinking about health in the context of neighborhood scale projects on eco-district principles. And I think thinking about it in terms of a community empowerment health model, a community empowerment framework might be useful. And at least 4 things under that. One is, our definition of health going beyond the physical, going beyond the corporeal, maybe even going beyond the hardware, the landscaping. And so what does that mean when we take a more expansive view of health to the kinds of projects that we're talking about? What are we doing to engage community residents as empowered agents? And I want to push us to think beyond just listening to their voices, to actually thinking about how decisions get made in projects, how resources get allocated, and what's the role and presence of community members and targeted groups in that. Third, it has to do with the use of data. Perhaps there's something to be said around how we might use data, benchmarking, metrics to not only measure impacts, but in turn inform and guide ongoing decision making. And then lastly, something about investments. As we think about eco-district type projects, what are the standards of accountability and guides that we want to use to help determine the upstream investments and the kinds of planning and master plans that we're putting together. So I offer that just for the audience consideration, for our panelists consideration. And with that, let me introduce our panelists. We're very pleased to have with us in conversation today, in addition to Michelle, next to her, Nathan Stodola, Vice President of Well Building Institute. Next to Nathan, we have Katie Swenson, VP of Design Initiatives for Enterprise Community Partners, and then Ismael Guerrero, Executive Director of the Denver Housing Authority. So welcome to you all. And I've encouraged the panelists to not wait for me to ask questions, because, to really jump in with questions of their own or comments that they want to make. But I do want to get us started, maybe Michelle, by going to you on the concept of health. So what's at stake when we broaden our thinking about healthy neighborhoods to include the spiritual, not the religious, but the spiritual dimension, as well as an emotional dimension? If you're a planner or an architect or a developer, what changes thinking about health in that way?
I'm still live. Okay. So it goes back to, I talked briefly about the dimensions of health. And so spiritual health is one of those dimensions. And when we define spiritual health, it really does not necessarily mean religious. It could be depending on the individual. But we're really looking at taking its values and applying it to our actions and our behaviors. And understanding that is also understanding opportunities for allow individuals and community members to practice mindfulness. And where are they engaging that? And also engaging the partners to support those ability to reflect and the ability to be together and applying those values. And so I'm going to give an example. So this is not religious related, but there was a trail system in a community, and in this trail system there was a regular group that would come together on a pretty regular basis to walk this trail. And so we asked the question, I'm like, oh, is this an organized walking group? And they said, well, no, it just became this informal thing. We're actually all cancer survivors. And so this was our opportunity to come together to be able to reflect and provide an opportunity to just be among those who understand the impact of being a cancer survivor. And so they would come together and just walk this trail as a way of therapy for them. And so in terms of spiritual health, they were practicing this concept of mindfulness. And so having that opportunity in communities where people can actually be able to reflect and be able to practice that is very, very healthy for those individuals and also for the community. And it can be any age, any income level can be able to, if you have that, it can impact anybody. When
we think about how we pull the community in, I think it's easy for those of us that are seen as experts. We understand the principles, we're the architects, we're the engineers, developers. We can fall into the trap of thinking that the causal arrow goes in one direction. We design and build the forms, the landscapes, and then that in turn can shape behavior. And I think part of what we're hearing today is that when you invite folks to the table, the arrow goes in both directions. And a lot of times the end users can significantly change how they engage with our projects in ways that the planners and developers may not even imagine. You just go through any ethnic neighborhood in New York where I grew up, and that's become clear. So I'm wondering what we're seeing when we bring people in for true and deep engagement, how they're getting engaged in the process, and how might their involvement impact and shape and reshape what it is that we're trying to do with our projects. And Ismail, I wonder if you could talk a little bit about the Denver Housing Authority and the work you guys are doing, either with Mariposa or Sun Valley.
Sure, thank you. Well, I think often, as we've heard today, when we talk about engaging community, it's often, we come at it with a specific end goal in mind, right? It may be to do a station area plan, or we heard about cultural surveys. In our case, we learned we were coming in to do a housing plan, a master plan for a new housing development. We were replacing old public housing. We wanted to build a new community. But as a housing authority, we naturally were thinking about the number of units, the sizes, locations, and things like that. And I think when you engage and you do it authentically, you have to be listening to what the community wants to talk about, and it's not always housing. As we engage with our residents and a larger community, housing was important, but they wanted to talk about the quality of life that they had in their community, not just the housing and what it was going to look like when it was replaced. And so we quickly had to, think about how do we expand the conversation. When you think about quality of life, that's where we got into the conversation about health indicators and social determinants of health indicators, or social determinants of health, whether it's the built environment or kind of social cohesion or what's happening in the community. And it was really a really dynamic process where when you let the community take the conversation to where they want it to go and the issues that are most important to them, we still got to the housing answers and the questions, but we got a much fuller conversation and really learned from them what were the issues that they were dealing with, whether it was around access to health care, the lack of safety, or the perceptions of safety and security in their neighborhood that would keep them indoors instead of a little more active lifestyle. So I think that was what, certainly what we learned, and our approach to that, our application of it, I guess, was what we call our Healthy Living Initiative Toolkit, where we're able to look at, not just housing, that's one of the elements of a healthy neighborhood, but so is social cohesion, public infrastructure, transportation, the environment, and those kind of, the economy, local economy. So it was really for us about broadening and for authentic engagement and to really have that two-way communication and participation from residents. They need to know that you're willing to listen to what they have to say and what their concerns are, you're not just using them to get what you need out of the community.
I'm curious about how, before we move on to some other topics, about how residents participated in decision-making in those projects. Because a lot of times when we talk about community engagement, we mean show up, tell us what you think, we take notes, and then we go off and make the decisions that matter, because we understand and we know, and we don't often validate, right, what the layperson, the folks that are actually going to be using the thing, knows. And in addition to that, I want to complicate it even more, and say that when we start adding issues related to cultural identities, ethnic identities, and the practices and norms that comes with different culture, that can be an affront sometimes. I'm thinking of a book I read recently that talked about the Latinoization of communities, that the colors that people want to paint their homes, or the kinds of ways they use the public space, and dominant groups, whites, middle class, affluent groups, being very uncomfortable. So the question of we, who constitutes the we? We is both a shared space, but it's also a contested space. So that's a lot of background to say. I'm curious as to how, with the Denver Housing Authority projects, community members get pulled in at the decision-making level, and how did that change, if at all, how the Housing Authority was thinking of things?
Sure. Well, I think we've certainly been learning, as we've gone through the process from one community redevelopment effort to another, trying to learn, lessons learned from the last experience. And I think what we have, one of the key takeaways is to start early in the process, right? Really, the visioning is important. Communities have often been, especially communities of color or disadvantaged, disenfranchised communities, have been studied very often. I've had planners come in and do studies, and then they go on the shelf. Plans are developed, and they don't often result in anything really. If you've been asked to go to multiple meetings, and every other year you're asked to participate in a focus group or a plan, you get pretty jaded on it, right? And you kind of lose lack of trust in the folks that are asking you to engage. So we've seen that you really have to listen and demonstrate that not only you're listening, but what they're saying is being incorporated in a kind of iterative process. So we always take, from early on, make sure that the plan is a reflection of the vision and the goals that the community has, at least as we've heard it. When we go through the process from visioning to conceptualizing to design, at each step, as we're asking for input, for feedback, the next time we come back, we show them where their input made a difference, where where the decisions change or the options are different based on what we heard the last time, and then we have that kind of continuous engagement. And it's not everybody, but as the 80-20 rule, 20% of the community will do 80% of the work or will show up 80% of the time. So you work with those leaders. And those that don't show up as regularly, we would go out and do smaller group sessions, one-on-ones, just to make sure we're getting as much input as we could from throughout the community.
I also want to point out that the community involvement and the listening to the community is a vital tool in a lot of cases, particularly in a lot of urban areas or with populations that may have been marginalized in the past, but that there has to also be some basis, like the checklists that the CDC or ULI is organizing, or the programs that the International Wellbeing Institute are developing. They are all based on sound ideas, and in a lot of communities that are more of the white and upper class, particularly in suburban America, you ask the community what they want. They want an autocentric cul-de-sac and their biggest concerns are going to be that they should probably have a left turn arrow so it's easy to get on the interstate, and they're annoyed that this bus stop is taking away a couple of parking spots. So you have a lot of community involvement there, but that is helping neither health nor equity, so that understanding the colors that should be used for the identity to make spiritual health and everything like that, it is very important to get that sort of engagement, but always keeping in mind what are some of the basic facts that we do know about public health that are just non-starters.
Yeah, it's a good reminder. Absolutely. It's like finding that balance between what we know and then getting the input from community. And it's a two-way, it's a dialogue, and it's also learning on both ends. So thank you, Nathan, for that.
If I can If I can interject here, is one of the challenges obviously in any kind of community engagement piece is like getting the voice of the actual diversity of the community, and this is so important to really know who those stakeholders are and those the gatekeepers, whether it be the local pastor or that outspoken civic association person in the minority neighborhood. And with that is knowing those stakeholders who services the community the most. So while you may not in a community engagement session have all the true diversity of the residents, if you could pull in those who represent those who are issuing food stamps and WIC vouchers, they'll tell you by their clients who come in to get those, to apply for those, they'll tell you exactly what they're going to need. And they know their community pretty well, of those who are the most vulnerable. It's pulling in those people that are non-traditional to our typical community engagement process, pulling in the people who are servicing the people who have the most vulnerabilities. And then taking it to a next step further is the implementation of that. So you have the community engagement piece, you have that plan. It's all good if it's only good if it actually implements, and it's bringing back those same stakeholders, whether it be those the public health clinic who's issuing WIC stamps. WIC, if you don't know, WIC is the vouchers for pregnant women and birth to 5 who are low income. It's also bringing in the people who require job training and job skills, vocational training. Those who, those are the majority of the people who the low income skills. They live in our community, so it's bringing them back. Those stakeholders, bringing them back to work on implementation.
I know we don't have a lot of time, and I do want to get a question in or a conversation going about measurement and data. If we're talking about healthy neighborhoods, what are the ways in which we can use data to try to get to the neighborhood level impacts that we'd like to see? And what are some innovative ways, or what are some ways that you all are working on that? I was struck, I was in Stockholm, I think in 2014, a couple years ago, this beautiful public art display. And when you walked up to it, it was actually showing you municipal water quality and air quality in real time. Fluctuation with colors. I know Denver last year with Aclima and Google Earth did an urban air quality measurement assessment. So we have the opportunities and the technology now to be connecting data, not just at individual level with your Fitbit, but driving it at a more collective level. And I'm curious as to your thoughts about measurement, benchmarking, and use of data for healthy neighborhoods.
Yeah, I'm sure we're able to get into a deeper conversation about all the many sort of strategies that are out there to measure. And certainly Enterprise has been a big player in that space. We developed the Enterprise Green Communities criteria and importantly have added a health impact assessment into that work and are actively working with our community-based partners to understand how to leverage that. But we also fuel and fund a lot of the community-based efforts. And I feel myself this sort of desire to both embrace data and kind of also maybe push back against some of this question around how and what are we measuring. I thought it was really interesting last night. I don't know how many of you were there, but I've worked with Jonathan Rose for like 15 years or something, and he gave his 9 C's of what makes a community. I'd never heard them. So he talks about cognition, cooperation, culture, calories, concentration, commerce, complexity, connectedness, and control. And I thought, how do we each define sort of what makes our neighborhoods or our lives meaningful? And how do we kind of come up with our own sets of impact measures? So we absolutely must pay attention to the critical health data and health outcomes, but I think there's also a role that we need to also interpret these things. Mm-hmm. One of our smallest but most sort of wonderful grant programs at Enterprise is to fuel work we call collaborative actions, which encourage community members. I think DHA is taking one on right now. To sort of do a lot of the community building space outside. And last year, we produced a beautiful book that's called Made with Love, and it's recipes for community change. And so in that, we asked people to sort of report on their projects. Only we said, okay, who are the cooks? What are the ingredients? And then what is your sort of impact chart in the form of sort of a nutritional table? And everyone was actually able to sort of define what their impacts were according very much to what their own goals in their community were. So I think that there's a role for both the kind of use of and partnership with the public health field, for sure, on actual health outcomes, which, as rightly pointed out, is a real health crisis. And also to make sure that we're using data in a way that we're able to also have community voices kind of express what's important to them as well.
Nathan, you guys do some of this data collection at the building level, right?
Yeah, so the WELL Building Standard is a collection of about 100 features across 7 concepts, ranging from water quality and air quality to the types of food that are offered in the space, towards even HR policies for employees that work in it. So we really take building to be more of a verb than a noun in that case. And one of the first metrics is that this is a leadership voluntary certification program. So we're hoping to incentivize projects to pursue these, to have these impacts across the board, and then also to gather that for the effectiveness. So one of the requirements is post-occupancy surveys to make sure that the people that are in the space are getting the advantages of the program, and then also the recertification after 3 years to show that everything that you did so well the first time is being maintained, and this isn't one-off stamp that you can forget about and defund after the PR dies down.
What are you guys seeing in terms of gaps? So what's not working? What are kind of like, assumptions you made going in, expectations we had, and the data or people's response just didn't match what we thought? What can we learn from what's not working?
I know our experience at Mariposa and other community initiatives that we've launched is that you really have to think beyond the planning, the design, and the building. Once you launch programs, how do you ensure that they're actually working? What you thought was going to work is actually playing out. And so the data collection for us is as much, having that feedback loop so that our programs can be continuously adjusted and modified, because you never know if you're really going to get the outcome you expected. And a couple examples are when we did one of our senior properties, we installed a bike share station just outside the building, and we gave everybody a free membership for the year. And we thought we were done, right? You got your free membership, there are the bikes, there's your card, go for it. And a few months later, we're looking at the usage, and there's hardly anybody using it because many of our residents hadn't been on a bike for years. They hadn't, if they don't have a credit card or aren't used to using one, they don't know how to use the bike share machine, the station. So we had to have, this is one of the things we've learned is you have to embed staff in the community to really be the program activators and make sure that they're seeing what's working and making adjustments. So we quickly formed the bike club. And we had our health program coordinator go down, get a group together who were interested, go down with them, show everybody how to use the bike share station, do
weekly bike rides through the neighborhood to show where you can get to on the bike, how to get to the grocery store safely, how to ride your bike to the library or to the bike path. And then after a couple of months, then residents were starting to do it more on their own. But you needed that. That's just not really data other than real-time data. So are you really seeing the outcomes that you expected? We're now tracking similar data on we want a healthy eating, active living community. So we're trying to track what are people eating. What's the nutrition? How are people eating differently? And bringing partners into the community to see to add programs so that they actually have access to not just the food, but the knowledge of how to cook it and prepare it, the right way, and how to share it with the rest of the community. And the same on access to healthcare. So we hired a health navigator to really be the on-the-ground person, day-to-day interacting with residents and asking them, do you have a primary healthcare provider? And if you don't, let's help you get there. And the outcome from that was, I don't remember the exact statistics, I know my staff knows it better, but we reduced the number of ambulance visits to our senior disabled community by like 50% in the course of a month or two, because people were calling 911 anytime they had any medical condition or situation. That's all they knew. That was their help. That was their connection to the healthcare system, was call 911, paramedics will come, and they'll take care of you. We're able to flip that around and kind of empower them to have a medical home and then take care of their health more proactively.
And I wanted to add on the how do you sustain programs. One of the things I've noticed is that we have a challenge of maintaining momentum in the work that we're doing, and we call it, we need to find our partners. We have our partners, but really knowing who are our partners and really understanding what are some overlapping leverages that we could to pass the passion baton. I don't know how, pass that passion baton so we can actually maintain the momentum, maintain the work without having one entity being the sole responsible agency to do all the work when you have all these other organizations that have similar mission statements, similar work, whether it be implementation or program development or evaluation, is start leveraging those resources so that you can continue the momentum and, again, pass that passion baton so that there's no burnout.
I'm reminded from your slide with the iceberg that the built environment is only 10% of the contributing to the kinds of health outcomes that we want. And so are we paying enough attention as we're thinking about building these healthy neighborhoods and at a district level about the kind of social relationships that we can kind of use in innovative ways? And I want to call out something I saw in Julian's book, The Sharing Cities. If you haven't looked at it or gotten it, you should really take a look at it. There's an example, Julian, if you're still in the room, that you gave. I want to say it was in Stockholm. They trained people in the neighborhoods to do CPR. And when a call comes in, 911, that someone needs an ambulance, it also sends a text to the volunteer who's trained if they're within 500 meters of the reported need. So, and in 54% of the cases, the volunteers actually show up before the ambulances. And so, examples like that about how we actually use folks in the communities as not just consumers, but as producers of the health outcomes that we want, I think are just really interesting and fascinating and are working in lots of other places.
I think there's also a big opportunity when you say sort of where are some of the gaps and how do we leverage this moment. We have a pediatrician on the board of Enterprise Community Partners. Her name is Megan Sandal, and I think she really kind of shocked our board in a way when she tells the story as a pediatrician in Boston. She has children who come in and visit her clinic, and they are experiencing, asthma or whatever, related stressors from the effects of poverty and insecurity. And she sort of says, I really just want to write them a prescription for a healthy home. And it's this kind of moment where many of us who've been working in affordable housing for a long time have this moment where we're sort of flipping the switch. It's no longer sort of promoting affordable housing or sustainable communities outward. It's sort of understanding that we're a critical sort of response team to this public health condition. So as we use our data, I think it's also to use it incredibly wisely. We're developing a new program in Enterprise called Communities of Opportunity Index, which will seek to sort of align many different data sources. There are lots of different ways to measure how much opportunity a community has, but it's going to pull in data sources from many different sources. We hope that it will become not just a way to sort of analyze a neighborhood, but also a way to help define what kinds of prescriptions we need to write. So that as we use that data and we understand what are the health impacts that neighborhoods are having, we're able to use that data as more of an analysis tool for action and for sort of writing those prescriptions, whether the prescription is a healthy, affordable home, so a child doesn't need to move many times, or whether the prescription is around transportation or school or healthy food or the other elements. But making sure we're really leveraging our data and leveraging this kind of public health perspective so that our sort of built environment and sustainability commitments can really have the most legs.
So where do we spend our dollars in the last couple of minutes that we have before we open it up for audience question? Where do we spend our dollars? What do we decide to, what should guide our thinking about what we invest in order to drive the health outcomes that we want? And Nathan, I know part of well-built in terms of standards and codes could be used. I wondered if you could talk a little bit perhaps about that. And then Ismael, Denver Housing Authority, practically speaking, how did you all make your investment priorities?
Yeah, well, I would say that one of the things that the well building standard and the well community standard that we have under development now, one of the goals that we have is to make building healthy the choice for the private sector. This morning there was a lot of talk about the role that the private sector has, the role that the government has, the partnerships, that whether they're implicit or a real PPP, and that there will be like enlightened government organizations that do things, but either sometimes it's going to be beyond their scope or just their internal bureaucracy or will to do it. And to the extent that we can make designing for health in developers' best interests, that's one of the goals. So by creating these programs and making this a leadership standard that projects can implement and really see the public benefit of, while making sure that there are parts of the standard in the rating system that promote equity. That's one of the big goals to help bring in the private sector into helping to fund these.
Thank you, Ismail.
I would say one of the biggest lessons that we've learned, I know many others in the room as well, is especially as a housing authority, a housing developer, it's really the space, it's really what happens outside the front door that's most important, especially around healthy, active living and a healthy community. So, how do you design and how do you build the common areas, the space between the buildings, so it's inviting, it's safe. You encourage that active lifestyle. We've got we call our active stairwell. So, you tuck the elevator away, behind the stairs. The stairs are the front, really what people see when they come out to the door. So they interact in the stairwell. It creates more social cohesion. We know that having a place to go when you're in your community is critical. There's data on how girls in particular, young women, the incidence of obesity is like 100 to 200% higher in neighborhoods that don't have amenities for them to go to after school, where they just stay home and kind of have more inactive lifestyle. So a lot of what happens outside the front door, I think, is what we've been learning. The second thing is, how do you sustain the programs beyond the kind of the development phase, when it has to be in year 5 to 10, how do you continue to invest in the staffing and the programs that really activate all the design work that you did up front?
Thank you. So with that, I think we'll open it up and see if we've got questions from the audience. Got someone over here. We've got a mic coming to you.
So I have to admit that I bristled a bit at the concept that we should not build tennis courts in disinvested communities as opposed to basketball courts. How, in large part because sports are not culturally specific. They are oftentimes based on cultural and racist exclusions that have happened over a period of time. So how do you create amenities in a community that do not necessarily fall into repeating some of the cultural stereotypes and exclusions that have taken place, while at the same time being responsive to the ethnic or cultural communities that may exist?
So that example that I gave was largely from a community where a developer came in and had their own prescribed idea of how they should build this community. And when the developer goes back, they're like, why isn't anyone using these amenities? And they did focus groups, and they did focus groups in the community, and that was the feedback that they get. Like, why we would like our kids want to play pickup game of basketball, and there's no basketball court in this area. We have a tennis court that we can't use, and for a basketball court. And so that was in response. I use that example. I mean, I don't mean to provide any kind of stereotypical, but it was an example of not engaging the community in the planning process. But then when you have, this is where I go back to the checklist idea of like, okay, do I have physical activity amenities checked? Do I have sidewalk that connect checked? But if we don't engage the community of the people, the consumers, the actual users, if we don't engage them from the very, very, very beginning, we may turn out a product that is not getting the use that we were expecting. And so that was the response of a thought like, well, we should have engaged this community from the very beginning. If they wanted basketball courts or a walk wall, we should have considered that in the planning and not put our investment into this product, and now we're going back to change everything to make sure that we were meeting the needs of the community.
And I would thank you for asking the question and allow us to explore that. And I wanted to also share an example. When I was chief of staff for a city council member in Houston. And we went into our district and wanted to build the kids, I don't know how Skateboard Park came up. It was a working class black community, historical, and the improvements, the design team came up with skateboard parks, and the residents went ballistic. They're like, this is just an example of gentrification. You're building infrastructure for the people that you want to come in, and not for our kids. No black kids skateboard. Of course, today, you know, black kids are skateboarding, but I think it's to your point about this responsiveness, and when folks don't have what they're asking for, so you're ignoring what they're asking for, the basics, and then you're trying to give them something else, then things get looked at as scans, right?
I think Venus and Serena Williams might disagree with the panel.
Who?
I think Venus and Serena Williams might disagree with the panel discussion.
Yeah.
But,
Well, not with the whole panelists. No, I think what we're saying, I think we're saying the same thing, right? Which is that we need to create opportunities, not be stereotypical about what it is that communities want, but sometimes when we try to provide additional opportunities, when they're base opportunities, what they're asking for at base is not provided. We want basketball courts. There are no basketball courts, and you're giving us a skateboard park. They don't want it to even be open. If they had basketball courts and skateboard parks, who knows, you know? So I think that's.
We have a great question over here about process, but I want to remind everybody that we are tweeting about this. So if you don't know, we're at EcoDistricts on Twitter, and there's some great pictures of men's socks and great quotes of people that you see on here, and there's lots of fun stuff. So at EcoDistricts, but here's a great question.
I think mine are better than Bill's, though.
I'm interested in asking you a question. Oh, Paul Crane from Seattle. I have a question. You talked about engagement, but have you engaged youth in designing the space between buildings, if I could borrow Jan Gel's great book and idea from way, way back when? When I was in Stockholm, what the city of Stockholm was doing was, I'm sure you heard of Minecraft. Well, they had a special version of Minecraft where they brought youth in who used Minecraft to come up with a design for the space between buildings, and these were youth that had rioted there. They were Afghanistan and Iraqi immigrants, political refugees, and it worked out incredibly well. They took that Minecraft and they turned it into construction documents, and that was what formed the space between buildings. Have you considered using that sort of medium and engaging youth at the very, very beginning of the design process to design the space between buildings?
We actually, we got so ambitious about engaging our youth, and there's some design teams in the room who had the privilege of the experience. We actually used youth during the selection process. So our design teams were interviewed by and were part of the decision making even on which design team was going to be selected to do some of the master planning for our current community, Sun Valley. And that came after they had worked with some local partners on doing design work in their neighborhood before the professionals came in, right, before the design teams came in, but working just as on their own to really, understanding and exploring their neighborhood. They could tell us which trees were the best trees in the neighborhood for climbing, to make sure that's the tree that was kept and preserved, to talk to us about how the river front in Sun Valley was viewed as a dangerous place, because really nothing good, there was no good access to it. You didn't think about the river as an amenity, it was a place to avoid. So we learned a lot early on from the youth in Sun Valley, just as an example. And then again, we had them come in and they were part of the selection process to select our team. And then they've continued to be engaged from visioning through the design work. So it's a great question, and it's something you do need to do intentionally and resource it, right? That you take some resources to make that happen.
Well, thank you. I'm told that was our last question. So I want to thank our panelists and invite you to thank them as well.